So for another concept related to contraception, we're looking at what is known as an unmet need for contraception. Unmet need for contraception. So for this unmet need for contraception, it just simply has, these are the different types of contraceptions we have, of course. It just refers to women who want to delay or stop childbearing. So a woman wants to delay or stop childbearing, but she's not using any one of this. How is that possible? Do you understand? So this concept is crucial and is used in understanding the gaps in reproductive health services, and also this will guide policy making. Right. So global scope is this: over 1.9 billion women of reproductive age worldwide. All right. That's worldwide. All right. So about 164 million of them have unmet need for contraception. They want to stop, childbirth. They want to stop it, but they are not actually using contraceptions. So developing countries, around 215 million people in developing regions either use no contraception or rely on less effective traditional methods. So it's more common in regions that are still developing. You understand? So in Africa, in Sub-Saharan Africa, only 58% of women have access to modern family planning methods, with some countries reporting usage rate as low as 4%. You get? So it's just something that actually, affects a lot of those countries that are still coming up. So let me say, so unintended pregnancy. So women with unmet needs will usually get pregnant. And of course, the pregnant are always pregnant that they don't want. So the woman doesn't want to get pregnant, but she's not using contraceptions. You understand? That's what unmet need of contraception simply means. So this usually leads to what? The woman not wanting the pregnancy, so she wants to actually go in for what? Abortion. And of course, most of them, if you're having the issues right from you not having access to contraception, you are likely to not do an abortion that is good. All right. So it could lead to death of mothers and also death of babies. So maternal mortality, social impact is lack of contraception can hinder education, environmental empowerment, and contributes to what? Unsustainable population growth. So causes of unmet need is what? Access barriers. So maybe, reaching out to a healthcare provider is like almost impossible, So maybe social or cultural factors, healthcare system challenges, poor quality services, provider barriers, of lack of youth-friendly options. So solutions is just raising awareness, addressing all those traditional myths that have to do with contraception, policy support where they have to strengthen reproductive health policies, all right, improving services, that's access to modern contraception, and ensuring that there's quality care reaching everybody. So that's it for unmet need for contraception.